used to actually joke around with people that my knee that I actually had repaired was the best joint in my body because it was the only one that didn't hurt in the morning. Hi, about 13 years ago, I started developing arthritis symptoms in my right knee. I was a lifelong runner, trail runner, mostly hiker, and I couldn't do it anymore. Started feeling really down about it. Eventually found Dr. Stone. Came out to California. I'm from New York, and had an allograft, a meniscal allograft replacement, and an ACL repair. Went through the therapy, and within months I was doing things again, and as I gained more confidence, did more and more, and it lasted, well, but 13 years later, I'm back and going to be getting a tune-up, and during that time I was able to do everything that I used to be able to do, and even then some. I used to actually joke around with people that my knee that I actually had repaired was the best joint in my body because it was the only one that didn't hurt in the morning. Which I'm sure a lot of people approaching my age could probably understand. But they did a great job here. Yeah, and I also found if anyone's thinking of coming out, the biggest mistake I made was just waiting too long and to do it. I would encourage you to give it a shot and come get a consult and have it done if it works right for you. I had a great experience here. I was a runner, active all my life, and I was a runner, and I used to, do amateur marathons and that sort of thing, and then I actually was trail running once and hurt my knee. Didn't know what it was at the time, and had a local surgeon where I'm from do a meniscus repair. They actually took out my meniscus, which I didn't really know they had done that, and then kept trying to run and it just ached. So I developed osteoarthritis because I had no cartilage there. It didn't take too long, and it was sore, and by the end of the day, so what I found myself doing is I was starting to do less all the time to accommodate it, and I was constantly trying to accommodate it more and more and doing less and less, and it was miserable. I couldn't do the things that I wanted to do, and at first it was just kind of, I'm not going to run 5 or 10 miles today. I'm going to cut back, or I'm going to do it, less, not every day, or, not climb as far, but, sooner or later it got to the point where I had to do something. And that's why I would encourage people to do something sooner than later, because, you're going to have to eventually. Yeah, so at first the therapy is pretty intense afterwards, and I kept up with it. I just started walking. I live in a place where there's lots of snow, so a lot of that involved walking in kind of interior environments and that sort of thing. And then I started eventually hiking and long distance walking. Didn't get straight back into running. I think I was really just too scared to do it. Didn't want to mess anything up, but eventually I was able to start trail running again. And then just more and more, and after 13 years I was back to at least at what I used to do. No, I had no, and I think that's what stopped me from when I first left here, from doing the things that I was going to do before. I think it was in my head that there's no way I'm going to be able to go back and do those things. And maybe it would have taken me that long, I don't know, but I get the feeling I probably could have done them sooner. Because by the end, once I felt like I was back, I was doing things I wouldn't have even thought I was going to be able to do before I hurt my knee. So, yeah, and it felt great. My whole life revolves around it, to be honest. It really does. I don't know if that's healthy or not, but it does. A lot of it, yeah, it does. Yeah, and it's to have it taken away is devastating. It really is, when you're used to it. And just like you said, because it's more than just running. It's being outdoors and in nature, and doing it in those kind of environments all season long is just something you can't get out of many. Well, for me anyway, it's not something I can get easily out of other forms of exercise. So, yeah, it was great to be able to do it. I came back here because I really wouldn't have anyone else work on it. I had such success the last time. It was suggested to me by quite a few people, why don't you just stay locally? There are more people who are doing these kinds of surgeries now than back in 2010 when I had it, and I had such a good experience here. I wasn't just not going to do that. So I'm back now. It lasted for 13 years, and then I falling is part of trail running. The first thing you learn to do is fall, so I think I just fell one time too much, and basically I had a couple good falls over the summer, and I basically tore my meniscus again. So I'm just going to be back here for a meniscus allograft. I just saw the surgeon, and that's what we're going to do. Apart from the surgeons you pick, I mean, you get out of the rehab what you put into it. You really do, and if you do, you know, are patient with yourself and you do what's expected of you and you take the time to do it, it actually helps tremendously. You'll see the results. It can take time and it can be very frustrating, but you will see the results.